Good afternoon and welcome to the YouTube series of Empowering Experts by Rotary Club of Nagpur North. I am Rotary Ann Simran Dara, the host of today's YouTube live session. I take this opportunity to thank our Director, Vocational Services Rotary, Vikas Manglani ji, President Rotarian Jyotika Kapoor, Honorary Secretary Projects Dr. Ali Akbar Mehmoon, and Honorary Secretary Admin Rotarian Vinay Dara sir. This year's Rotary theme is Imagine Rotary, and we, the team of vocations, have variety of interviews for all our viewers. So let's begin today's session by introducing to you all our guest speaker, Dr. Suhana Madnani ji. Hello, ma'am, and welcome.
Hello, good afternoon. Thank you. Thank you so much for giving me this opportunity.
Thank you. You're most welcome, ma'am. So let me all introduce to you our guest speaker for today. Dr. Suhana Madnani is a founder-owner of Keval Physiotherapy Clinic and Core Energy Fitness in Nagpur. She is a dynamic lifestyle modification professional with the experience of 13 years in physiotherapy, nutrition, and fitness. She is an expert in yoga, Pilates, core stability training, and fat loss. She has been awarded as Ambassador for Peace by Center of Peace Studies, Sri Lanka in 2019. After completing her bachelor's degree in physiotherapy, she worked with various clinics, hospitals, and organizations. But soon she realized that for healthy lifestyle and long-term consistent results, so she decided to work on all other aspects of health, like nutrition, fitness, stress management, lifestyle counseling. So, with her wide spectrum of knowledge and experience, she decided to start a lifestyle wellness center. So let me all make you aware of her degrees and credentials. She is a Bachelor of Physiotherapy. She did Bachelor of Physiotherapy in 2007, Certificate in Nutrition and Childcare, MSc Dietetics and Food Service Management, CPS Ambassador for Peace, Pilates, Getaway to Core Training Stability, Certificate courses in Orthopedic Manual Therapy, Advanced Certification in 2007 for Yoga, Advanced Face Yoga Certification from Sarva Yoga, Basic and Advanced Kinesiology Tapping, TheraBand Workshop, and many more to come. Food Biomechanics Assessments to Effective Treatment Certificate, Gait Analysis in Neurological Conditions Certificate, Dry Needling Level 12 days workshop, 2 days hands-on workshop of modified chiropractic manipulative therapy and osteopathy, myofascial trigger points and myofascial release certificates, certificate in pelvic dysfunction, hands-on manual therapy and tapping techniques, musculoskeletal pains, physiotherapy protocols certificates, 1-day workshop on diabetic foot, pre and postnatal fitness instructor training, intensive aerobics instructor training. Oh, ma'am, so much to you. That's great. I'm glad to have you on our show. Welcome to our show.
Thank you.
So let's begin. Before beginning our session, let me wish all our viewers and you too a very happy Physiotherapy Day, World Physiotherapy Day.
Thank you. Thank you so much.
So, ma'am, can you tell us what is the theme of this Physiotherapy Day this year? And can you please share a little bit of more information on this?
Yeah. So every year on 8th of September, we celebrate World Physiotherapy Day. It is a day for us to create awareness regarding physiotherapy, to tell people our role and how we can help them move further, how we can take them towards wellness and improve their function. So this is an opportunity for us basically to create awareness. And this year, the theme is osteoarthritis, its pain and the management. Osteoarthritis is basically the inflammation of joints. So that joint can be knee joint, hip joint, wrist, any joint. But more common, I would say, millions of people in all over the world are affected by osteoarthritis of knee joint. So it's a debilitating condition. If you have pain in knee joint, you won't be able to do a lot of things. Okay, so that is a very important thing which they have selected for this year. In osteoarthritis, there is pain in the joint, there is swelling, and you're not able to do your daily activities effectively, like sitting up, down, and climbing stairs. Everything becomes difficult. So here the role of physiotherapy comes. So there are a lot of risk factors related to osteoarthritis. Main reason is overweight and obesity. And then there can be an injury leading to arthritis, early arthritis. If, for example, you are injured a little bit with exercise or in gym or with any fall. So after that, the joint is not the same as before, as it was made by God. So now it is changed. So what our role is to improve the muscle function. So we improve the muscle function and give stability to the joint so that you work effectively and you are able to do a lot of things which you were not able to do because of the pain.
Right. But ma'am, nowadays, at very early age, people are having all these problems. पहले ऐसा नहीं हुआ करता था. पहले ऐसा था old age के साथ all this used to come. But why is it so कि अभी एकदम like 30, 35 में you get all these problems?
Yes, the basic reason behind this is the lifestyle change. Previously, we used to work a lot physically. Now we are not working physically much. For each and everything, we are dependent on digital media. All the work is done on the click of your finger. So you can do a lot of things sitting at one place. That's sitting at one place, like sitting nowadays, they say sitting is next to smoking. So sitting is very, very hazardous actually for health. So if you're not moving your joints more, if you're not letting your muscles work, that will surely cause problem.
Okay.
अगर छोटी सी चीज है, अगर आपको बैंक का काम रहता था, आप स्पेशली जाते थे, बट अब वो सब नहीं रहा. अभी सब कुछ हमारे हाथ में है.
Everything has been done.
Everything is in our hand, in the mobile.
Right. And also somewhere the diet also affects, like abhi junk food और ये सब थोड़ा ज़्यादा हो गया है intake, ready to eat
definitely.
mixes. That also affects.
Yeah, the reason behind this, I think, is more of the females are working and they don't get enough time to cook. They are dependent on maids for cooking, and they are dependent, or maybe they think of quick fixes. So quick fixes really like कि आज ये नहीं बना पाएंगे, इतना टाइम नहीं रहेगा तो शॉर्टकट कुछ बना लेते हैं. बट that shortcut, that we call it fast food, जो हमें junk food या fast food हम कहते हैं, जिसमें से हमें energy तो मिल जाती है but nutrients नहीं मिलते हैं. So if you're not getting nutrients out of your food and you don't have time to cook, you will land up in trouble. That's for sure.
Exactly. Okay, so this is the physiotherapy part, ma'am. And you had done so much with fitness, nutrition. So what role does exercise and fitness plays with the physiotherapy?
Okay, so for example, I have treated a patient and he got pain relief. He's able to do all the pain relief exercises, and the question comes, what after that? जो patient जाता है उसके बाद वो repeat कुछ महीने बाद वापस आता है. ठीक है, वो सेम पेशेंट सेम प्रॉब्लम लेके या फिर कोई और प्रॉब्लम लेकर वापस आता है अगर, तो हमारा रोल वहां पे ये होता है कि हम उनको अवेयर करें कि आपको रेगुलरली एक्सरसाइज करनी है. एंड इफ दे से दे आर नॉट एबल टू डू एट होम, वी गिव देम ऑप्शंस कि आप यहाँ पे आके हमारे सुपरविजन में कर सकते हो. एंड देन देयर आर ऑप्शंस लाइक पिलाटेस, योगा, फंक्शनल ट्रेनिंग, जिमिंग. वी हैव ऑल द ऑप्शंस एट आवर सेंटर. So this is how I include fitness with physiotherapy, because patient कभी भी patient ही नहीं बने रहना चाहेगा. Okay?
Right, exactly.
So, exactly. They won't like to be on a bed only कि आप हमेशा मुझे bed पे ही basic physio exercise करवा रहे हो. They want to move further, and even I want them to move further. ऐसा नहीं हो सकता कि आप same boring कर रहे हो और आपको मजा भी नहीं आ रहा है. That is very important to make them feel good with exercise. They should start loving exercise. That is my aim. If they don't love their exercises, if they don't love their routine, they will not be able to follow. And once they're able to follow this routine, the change in exercise each and every day, they'll start enjoying and they'll follow the plans regularly.
Right, right.
Yeah.
So this is the only reason, like you being so thoughtful for your patients, कि आपने फिर वो fitness centers and ये आपने
Yes, that was the need of our, actually, that was the need. Everybody used to ask me about, fitness, weight loss, and ये तो हमने कर लिया, अभी ठीक है, आगे कैसे करेंगे? There were always questions. And this was the reason I entered in nutrition also, because I had to answer so many questions and I had all the data and, history and details of my patients.
Right.
When we assess, for example, if I assess ankle joint, it is not just the ankle. I have to assess the posture, the walking pattern, the workplace, and in fact, you won't believe that I tell them to give me the CCTV footage or tell somebody to take your video when you are at workplace. So the mistakes that they do at workplace show up with pains. So we have to be that close when we assess the patient. So for example, if I assess for 40 minutes, my treatment will be for 20 minutes only.
Okay. So assessment is more important, right?
Yes, in physio assessment.
You can be like, right, ये आप दे सकेंगे exercise.
Yes, perfect. And if, see, for example, they say we have these kind of pains, and if I have assessed and I just got one thing that there's only hamstring tightness which is causing trouble. So the treatment will be just the hamstring mobility and stretchings. Yeah.
Okay, fine. That's great, ma'am. So this is what sets you apart in the physiotherapy market. Like you being a nutritionist, you doing all these things together.
Yeah, and moreover, I think a physio himself or herself should exercise. There are a lot of physios, they are too busy treating patients that they themselves don't exercise. So when I exercise every day, I can feel and realize what is good, what is bad, what are the pros and cons, constipation ke liye sahi rahega, nahi rahega. So when I feel it, I innovate new exercises, and there are quick innovations like aaj ye patient pe ye suit nahi ho raha hai, so quickly innovation ho jata hai. So that is only possible when you yourself do exercises.
Oh, that's so great. So good.
So we have to be role models.
Yeah, we can see how fit you are and what you must be doing backstage.
Thank you.
So, ma'am, can you share what's the most challenging part of your profession?
Okay. Challenging part now and challenging part then when I started my practice is different. So I'm practicing since 14 years now. Yeah. So the day I went back my hometown, it's a small place. My dad told me, you come back now. It's too much that you're doing job, you're attached to so many hospitals and institutions, and you're taking personal home visits also. I said, okay, I'm coming back. I went back, and then I thought I'll be taking rest now, on rest. But he woke me up in the morning at 6 o'clock and he said, come down with me. So I went downstairs, and we had 3 rooms. And in our room, he had kept a table chair, and he started asking me what height you want and what length of table you want, all that. And there I was stuck. I said, what is this going on? He said, you have to serve your hometown. You are born and brought up here. You have to serve your hometown. I said, how is it possible? There is no physio here. He said, yes, that is it. There is no physio here. Wow. So I was the first physio there. And the first patient who came to me, I had told my dad they won't understand what is physiotherapy. He said, that's what you have to do here. And the patient came, and I had my letterhead and pen ready. I was thinking कि आज ये करेंगे, आज ये भी कर लेंगे, आज तो पूरा ही assessment कर लेंगे. But then when he came, rather than me asking him, he asked me, तो आप बिना दवाई के पेन ठीक कर लेंगे? So that was the challenge. When they don't have faith, that is the challenge. We know what we are doing, but they don't have faith. So from there, my journey started. I had to make them understand what physiotherapy is and why with pain relieving medications, you'll get some, side effects and all in long run. So now you have to shift to physiotherapy and exercises. That was the first challenge that I got.
Exactly. To earn the faith of your clients is the biggest, to be set in your career, no?
Yeah. And the challenge now is being present in front of each and every patient and client, because they want my presence every time. And when you have a family, it becomes very difficult.
So going further, I would like to inquire that these days everyone is very much health conscious, right? So, what are the most effective methods you have been encountering when you help your clients or groups to make their like lifestyle changes?
Okay. Yeah. So lifestyle, I have been working in lifestyle modifications since years now. And with my experience, I try and include a few things. One is exercise. Second is diet. Third is sleep. Fourth is stress management. And fifth is relationships, like relationship management.
Okay.
So the first thing is exercise part, which I work on. I give Pilates, which is the core stability training, which is very important for females, especially. So core stability training, mat Pilates, reformer Pilates, all this we do, and it works a lot. When your core is strong, you don't get load on other joints also.
Right.
So I work more on exercises like Pilates and yoga. Yoga is very close to my heart. I enjoy doing, and I have seen good results with that also. And third is the functional training, and then fourth is strength training. Then comes Tabata, high intensity training, and we have aerobics, different kinds of aerobics like chair aerobics. Someone who's operated and cannot do much of exercises can be given chair aerobics. Someone who is recovering from COVID, post-COVID recovery, or any cardiac cases can be given chair aerobics. This is also our specialty. So this all comes under the exercise part. We have some or the other things available for each and every individual, but even if the person is bedridden, then also.
Oh.
So this is one part. And then comes the nutrition part. I have to take complete counseling. 1 to 2 hours are needed for the nutrition counseling. And then the individualized diet plan is made according to their routine, choices, habits, and their preferences also. Impractical diets and fad diets, I don't believe at all. I don't give any fad diet and impractical diets, which are not practically possible by my clients.
And how much do you support, ma'am? Just sorry to interrupt.
Yeah.
How much do you support dietary supplements when you are working in a nutrition arena?
Yeah.
So, does it work कि अपन जो balanced diet we are having or natural foods we are having, those are sufficient?
See, if you have taken a diet plan and if your nutritionist knows everything about your problems and your blood test reports also, and all of the reports basically. So if you have followed a particular balanced meal and for say 6 months or so I'm sure you won't be deficient in any nutrients, right?
Okay.
But if you are recovering from a phase like अभी जैसे viral हुआ था तो बहुत लोगों को 15-20 days viral था, उसके post effects थे, COVID duration में हुआ था कि बहुत time तक लोग suffer कर रहे थे तो काफी weak हो गए थे. So that time you need supplements, and that supplements should be continued for say 2-3 months.
Okay.
And moreover, if we know the blood reports, if we know hemoglobin कम है तो उस चीज के supplements अगर हम देते हैं और हमें उसका पता है कि उसको constipation या issues कौन से प्रॉब्लम के हैं इश्यूज उससे रिलेटेड है तो हम वही न्यूट्रिएंट्स अगर दें सप्लीमेंट्स में तो वो बेटर रहेगा रादर देन हैविंग अ सेम प्लान कि सबको यही सप्लीमेंट्स देना है ऐसा नहीं होता है सो फॉर से 2-3 months if you follow and then you leave for a month and see how you're feeling, your energy, your stamina, your skin, hair, everything.
Okay. वैसे तो physiotherapists do not recommend any supplements or anything like
No,
you being specialized in nutrition, so you can recommend, right? You
yeah,
have...
I can. Yes, I can.
Okay, that's great, ma'am. One thing I would like to ask, other than your profession, how did you know about Rotary International and what made you join a Rotary Club of Nagpur North? Like you being a Rotarian now, I would like to know a bit about it also.
Okay. I know about Rotary since my childhood. I have seen a lot of people going in Rotary programs, but I didn't know much about it. Once I went to a camp from my internship program. That camp was good. There were a lot of doctors. They were treating patients there. It was a good camp in a village. So I liked that. And in 2018, Mr. Ajay Kapoor, our past president, he told me that you should be joining here. So that time I said, I'm very sorry. I was about to deliver my baby. And I thought it won't be a justice, neither to Rotary nor to my child. So I said I'll join because I like the concept of social work, friendship, and fellowship. This is so nice. I thought I should do it. But now, when I again got references through my few of my clients, and again I gave it a thought. But actually, joining right now, the reason behind is I want my child to be brought up as a Rota kid.
Oh,
So,
wow.
so I want that.
You want to inculcate in him कि थोड़ा सा
Yes.
social और ये सब वो अंदर से
Yes.
आना चाहिए, right?
अंदर से आना चाहिए.
So good, so good.
So social development जो pandemic life में जो बच्चों का नहीं हुआ है last he's 4 years now, so last 2 years से जो social development नहीं हुआ, हमने काफी restrict किया बच्चों को एक दूसरे से मिलने के लिए या कहीं भी जाने के लिए. So that has hampered the development. That's what I felt. So social development I wanted to start with Rotary.
Wow, that is so great. Great thinking, ma'am. And what do you love about your profession, ma'am? And can you just tell us कि what is the right time or how do we come to know कि हमको अभी physiotherapist के पास जाने की जरूरत है? हमारा ऐसे treat नहीं हो सकता है. Though we go for yogas and all, still there is एक वो doctor वाला need पड़ता ही है, ma'am. So how can you tell that?
See, you need a physio when you are planning to start exercises. You can just meet us and get the plan ready. You can tell us if you have any issues. If there are no issues, it's well and good. So we make the plan that will suit your profession and your age, your body type, all that. So I can make a plan that way. And otherwise, if you have neck pain, back pain, shoulder pain, any sprain, strain, muscle में injury है या ligament tear है, या फिर आपको डाउट हो रहा है कि ऑपरेशन ही करवाना चाहिए या फिजियोथेरेपी से ठीक हो सकता है, एटलीस्ट वंस विजिट एंड कंसल्ट एंड गेट इट क्लियर्ड with a physio who can tell you better about your muscle work, your exercise patterns. And other than that, a preconceptional stage also. So nowadays, girls come to us for, before they are planning to conceive. That is called preconceptional counseling. Okay. So in that, we discuss a lot about what they are going to face later on. So we tell them that this is all going to happen in your body because pregnancy में या फिर after pregnancy postpartum depression ये सब problems आते हैं. Right. तो वो time पे एक female समझ नहीं पाती है कि आपका अभी baby born हो गया है तो अभी हम baby की care करें या खुद के करें. जैसे बहुत से clients हैं मेरे जिन्होंने register कर लिया but वो baby की वजह से नहीं आ पाए. So we have to prepare them beforehand, and in fact nutrition wise also. Last week itself I came to know that there are a few of my friends who delivered their babies and the baby was just 2.5 kgs. That is fine, but the weight gain was also, like by the mother, was 2.5 kgs. Okay. And that is so saddening. If you're just gaining 2.5 kgs and your baby is born 2.5 kgs, so what is all gone? All the calcium and all the nutrients from your own body have gone. Right. So that, preconceptional nutrition planning, and if there is any acidity, if there is any constipation, you have to take care of all that and then conceive. So there are a lot of, fields where we work. There are neurological conditions, paralytic patients, hemiplegias, there are kids. We work in a lot of conditions.
Okay.
So this
for
way,
neurological conditions also, we need exercises like physiotherapy helps in neurology also?
Yes, definitely. Neuro is a specialized field in physiotherapy. So there are 4 branches: neuro, cardio, sports, musculoskeletal, and community-based rehab. So there are a lot of 5-6 branches, I would say. Neuro is a very important topic. If there is any kind of paralysis, there's say suppose there's Bell's palsy, it is facial paralysis. Half of the face is paralyzed. Right. So what will you do? Physiotherapy helps a lot in this. And same way for, half paralysis of the half body, or, after any accidents of spinal cord, if there is injury at the neck level or at the back level. So that requires physiotherapy. Neuro in physiotherapy, neurological conditions is a vast topic.
Okay.
Yeah, and we, all the physios, I would say, and especially what I love about my profession is that we get a lot of blessings. We get blessings every day. And that's how we feel it's a blissful profession. Physio is a blissful profession, and we sleep with gratitude.
Wow.
Because when you give pain relief, patient is definitely happy and they want to
Right.
give
That's good.
blood.
That's great. So good. Now you get blessings every day. You make people happy every day. That feels that makes you feels more happier.
Yes.
Great, great going, ma'am. And being a Rotarian now, how you wish to serve the society as a holistic approach?
Yeah, I have made a list.
Hmm.
There's a list that actually, when I attended the installation program, I was listening to the awards and what all is done in Rotary. That time itself, I was getting thoughts and what all I can do. So before sleeping that night, it was too late that night, but then I jot down everything. If I won't forget, ये मेरा problem है कि मैं भूल ना जाऊं, तो मुझे लिख लेना पड़ता है. तो मैंने लिख लिया वो सब कि क्या क्या fields है जहां मैं help कर सकती हूँ. What all people are doing. I was surprised to see how they take out time for doing so many things. So I have made a list and I have shared with few teams also what all I can do. That includes obesity. I can work on obesity. I can work on posture trainings. I can work with nutrition management of kids and of any underprivileged sector that they want, if they want to. So there's a list of topics related to physiotherapy, nutrition, and fitness on which I can work.
Okay, wow. So you have already you have plans for working with the Rotary Club already you have made.
Yes, yes.
That's great, ma'am. And it was good to know about nutrition and about physiotherapy, different fields, the services you provide, very nicely explained. So thank you for such an insightful session, Dr. Suhana. We
Thank you.
wish you a good day